Cue exposure therapy is a technique frequently employed by therapists that involves immersing patients in cues associated with drug use to support helping individuals with drug addiction maintain their abstinence from drugs. Although cue exposure therapy is an important part of psychotherapy, most of the research in this field didn't tailor the design of VR scenarios to expose cues, but focused on explicit drug cues that trigger intense cravings or the development of algorithms to detect the onset of cravings. In this work, we conducted an in-lab VR cue user study aimed at elucidating the effects of cue presentation on the triggering of cravings in virtual scenarios. We have two modules in our experimental VR system. First one is craving-inducing module. We classified cues into two categories, including external and internal cues. External cues are related to sensory experiences, such as drug paraphernalia, getting unexpected cash bonuses, and being in a hotel room. And internal cues are based on individual psychological experiences, like feeling bored, seeking to reward themselves, and strongly negative moods. Each craving-inducing scenario featured either an exteroceptive or interoceptive cue, which lasted for a uniform duration of 90 seconds. The other is user feedback module. The participants use VR controller to respond to the survey to determine the strength of the cravings and realism of a scenario. All the participants followed the same study procedure. First, the participants will overview the study objectives and procedures, also provide a pre-study self-assessment of their current meth cravings using a visual analog scale. After that, they will watch a VR controller tutorial and all the VR environments. In the end, the patients provide self-assessments of their current meth cravings again and take an interview with research team members to gain insights into their VR scenario experiences. From the interviews, we conducted qualitative analysis to elucidate how VR scenarios either facilitate or hinder the retrieval of past drug use experiences and how these experiences could potentially enhance patient-therapist interactions. According to trigger elements, some participants noted the information fitted with daily life, but differed from their own experiences. Besides, the erroneous arrangement of objects within the scenarios could hinder the evocation of cravings. They also pointed out that crafting cues to be overly realistic or detailed would drive cravings to unmanageable levels. To wrap up the video, in this study, we find out how to design virtual scenarios to properly elicit drug cravings in a clinical context. The following research will be conducted to identify the essential settings and a suitable interface by which to tailor scenarios to the patient before cue exposure. Thanks for your listening.